This video was made possible by the Laurel Foundation, Bay Area Lyme Foundation, and the Limelight Foundation.
Corey was 3 years old. I came home from work and he had a little red mark on the back of his arm. It looked like a freckle and it was red around it, and I was able to see that there was legs. I knew right away, my heart sank, I knew it was a tick.
Early localized Lyme disease, which we are finding that might be a simplistic term, but for the sake of argument is a very early infection, that the tick will bite you, often cause a rash. On the East Coast, we find between 40 and 60% of patients will get this classic bullseye or a different rash, about 40 to 60%. It's less in the Midwest, it's less in the South, looks slightly different in the South, it's much less in the West, and it's variable from country to country where Lyme is quite prevalent. It's quite important to understand the quantity or prevalence of various infections and make decisions with the patient about choosing to treat prophylactically before you actually get sick.
I'm a nurse myself, so I actually called his pediatrician in the morning and got him an appointment, and we started antibiotics the next day. At that point, he did not have any symptoms. His doctor was only willing to treat for 2 weeks because he wasn't familiar with Lyme.
Other times what you can do is you can wait and see if someone develops symptoms. Now, that's not always a very good idea because there are many patients who do get Lyme disease, but they don't actually get sick right away, which creates a huge problem of late Lyme disease.
At the end of the 2-week period, the doctor was reluctant to continue treatment just for the rash, but I talked him into it.
Some people get rashes, some people don't get rashes. It's very important to think about a summertime flu-like illness where other people aren't sick in your immediate family. Have you been in areas where there's high exposure? Even if it's not known that Lyme disease is common in certain areas, Lyme disease, again, is everywhere.
He did give us another 2 weeks, at which time we thought, okay, the rash has cleared up, he's not showing any symptoms, let's go ahead and stop the antibiotics.
The most common symptoms that happen often 3 to 30 days after a bite are flu-like symptoms, neck pain or stiffness, migrating muscle aches, and occasionally pain that initially centers in large joints.
We did that, and within 2 days he had a temperature of 104. He couldn't walk across the room, very sensitive to light. He couldn't walk into the grocery store just from going to the car to the door, so I'd have to carry him.
The hard part from a practitioner's point of view is to not overdiagnose it as well. So I do know that there are just bugs that people get. People get viruses. And so I don't want to see Lyme everywhere if it's not there. But when you put together the risk factors and you put together the time, the physical exam, and then you add the tests into it to give support to a clinical picture that's unfolding, then it becomes a bit more scientific.
And they explained to us what the test results actually meant, and then they started him on a treatment plan. He seemed to improve, but it took several months.
If Lyme disease is diagnosed early, within 3 weeks or so of the bite, then it's remarkably treatable. At least 8 out of 10 patients will have a very quick course and be done with it.
And I'd say November was when I really started to see my son kind of back to himself.
However, there is some debate about this. Is it, as some studies say, 1 or 2 doses of an antibiotic, or is it 4 to 6 weeks, as another group of scientists and clinicians think?
He loves going out and jumping on the trampoline, hiking. He is back to himself, and it's great to see.
If the proper treatment is given, which is still a fairly short course of plain old antibiotics, even just one kind of antibiotics, the disease can usually go away and not come back.
He loves playing sports, he loves being outdoors, loves hiking, biking, you name it, he's doing it. We're super fortunate that the outcome is what it is.